All right, let's dive into a real medical detective story. It all starts with something incredibly common, high blood pressure. But what if the usual treatments just don't work? What if the real cause stays hidden? Well, that's exactly where our investigation begins today.
So, have you ever wondered why some cases of high blood pressure are just so unbelievably stubborn, so hard to control? You're not alone. It's a puzzle that can frustrate everyone involved. But today, we're going to follow the clues to a really surprising answer.
Okay, so here's the first big twist in our case. The prime suspect? It's not the heart. It's not the big blood vessels you might think of first. Nope. The evidence points straight to the kidneys. Those two organs that play this huge but often overlooked role in keeping our blood pressure in check.
To get to the bottom of this, we'll first look at why the kidney is even a suspect. Then, we'll profile the two main culprits behind it all. We'll check out the high-tech investigation tools doctors use, figure out how they solve the case, and wrap up with a bit of a cautionary tale. Let's get into it.
So how on earth can a problem in the little arteries leading to your kidneys cause your blood pressure to just skyrocket everywhere else? Well, it all comes down to the kidney basically sending out a false alarm. It thinks there's a huge body-wide crisis, and it's just trying to do its job and save the day. And that brings us to this key idea, secondary hypertension. See, most high blood pressure is called primary, meaning we don't know the exact cause. But secondary hypertension is different. It's caused by another specific medical issue. And the best part, when that issue is renovascular disease, it's something we can actually treat directly. We can go after the root of the problem.
And here's exactly how that chain reaction works. When blood flow to the kidney gets squeezed off, maybe from a blockage, the kidney freaks out. It thinks the whole body's blood pressure is crashing, so it unleashes this super powerful hormonal system called the renin-angiotensin system. This thing tells the body to hang on the sodium and clamp down on blood vessels everywhere, which causes a huge system-wide spike in blood pressure.
Okay, so now we know how it happens. Let's meet the culprits. What's actually causing this blockage, this stenosis, in the kidney's arteries? Well, it turns out there are two very different bad guys responsible for most of these cases.
And this is where it gets really interesting, because these two culprits are worlds apart. On one side, you've got fibromuscular dysplasia, or FMD. This one tends to show up in younger folks, especially women. On the other side, you have atherosclerotic renal artery stenosis, or ARS, and that's our old familiar friend, plaque buildup. This is much more common in older people and is usually tied to wider vascular problems.
And just look at how common the atherosclerotic kind is. In the general population over 65, it's about 7%. But if you already have coronary artery disease, that number jumps way up to as high as 23%. And for people with peripheral aortic disease, it's over 30%. The takeaway here is that these things are all connected. Now, when that blockage from plaque gets so bad that it's not just causing high blood pressure, but it's actually starving the kidney of blood and threatening its function, that gets its own name. We call it ischemic nephropathy. This is when the case gets even more serious.
So, we have our suspects. How do we catch them red-handed? This is where the cool, high-tech investigation comes into play. Doctors have a whole arsenal of imaging tools they can use to peer right inside those renal arteries and see exactly what's going on.
Think of this as the detective's toolkit. You've got duplex ultrasound, which is usually the first step. It's easy, and it uses sound waves to check blood flow. Then you have CT and MR angiography, which give these amazing 3D pictures of the arteries. But when you need the absolute most definitive evidence, you turn to the last one on the list.
And there you have it. Intra-arterial angiography is called the gold standard for a reason. This is where a doctor goes right into the artery with a tiny catheter and injects dye to get a perfectly clear, real-time X-ray. It leaves no doubt about where the blockage is and how bad it is.
So, the diagnosis is in, we've got our culprit. Now it's time to solve the case. And treatment is definitely not a one-size-fits-all kind of thing. It really depends on what's causing the blockage, how the patient is feeling, and their overall health.
For a lot of patients, especially with the plaque buildup kind, the first move is an all-out medical attack. We're talking intensive blood pressure control, medications to block that haywire RAS system, statins for cholesterol, aspirin to help with clotting, and of course, major lifestyle changes like quitting smoking, all while keeping a super close watch on how the kidneys are doing.
But what if all those medications aren't enough? That's the million-dollar question. When do doctors decide it's time to physically go in and open that artery back up? That procedure is called revascularization.
And this is a big step, one doctors don't take lightly. They really reserve it for specific situations, like if blood pressure is still out of control on multiple drugs, or if kidney function is clearly getting worse and worse. Another huge red flag is when a patient develops recurrent heart failure. Those are all signs that it might be time to restore blood flow.
And now we come to our cautionary tale. Because while opening up that artery can be a game changer, it's not without risk. And one of the most serious, though luckily not very common, is a complication called atheroembolic disease.
So try to picture that plaque inside the artery like a crumbly wall of old plaster. During a procedure, little bits of that cholesterol plaque can break off. These tiny crystals then travel down the bloodstream and get stuck in the tiniest blood vessels inside the kidney itself, causing hundreds of microscopic blockages. And what's really tricky is that this doesn't happen right away. After the procedure, it can be a week, maybe two, before any symptoms show up. Then, over the next few weeks, it can lead to this slow, progressive, and really devastating decline in kidney function. And this is a tough number to see. The outlook is grim. The mortality rate, within just 1 year of being diagnosed with this condition, is over 38%. It's a very stark reminder of the delicate balancing act that doctors face.
So we end on this thought. For so many of us, high blood pressure is just a number to manage. But as we've seen, sometimes it's a clue in a much bigger mystery. It makes you wonder, right? Could the real key to our health be hidden not in our heart, but in the vital, complex arteries that feed our kidneys? It's definitely something worth thinking about. Thanks for tuning in.